Modifiers 24, 25, and 57 are three of the most missed items on the CPC exam. They look almost identical, and the exam deliberately puts them in each other's answer choices. But they are not three rules to memorize. They are three consequences of one rule, and once you understand that rule, you can work out all three from scratch. Here is the rule. When you bill a surgical procedure, the payment you receive is not just for the operating. It also covers the routine evaluation and management care that goes with that procedure for a defined window of time. That bundle is called the Global Surgical Package. Think of it like an all-inclusive resort. The room rate already includes your meals, so you cannot send a separate bill for dinner unless the dinner genuinely was not part of the package. Every one of these three modifiers is you telling the payer, "This visit was not part of the package, and here is why." So you need to know how long the window is, and that depends on whether the procedure is minor or major. A 0-day global period covers endoscopies and some minor procedures. A 10-day global period covers other minor procedures, and a 90-day global period means a major procedure. There is one detail inside that 90-day window that decides an entire exam question. A major procedure's global period also includes 1 day before the surgery. So the full window is 1 day before, the day of, and 90 days after. 92 days in total. Minor procedures have no preoperative day at all, and that single difference is what separates two of our three modifiers. Now the first modifier. Modifier 25 is for a significant, separately identifiable evaluation and management service performed on the same day as a minor procedure. In plain terms, the visit did more than that little procedure required, so it deserves its own payment. One thing about 25 that the exam tests directly. The modifier goes on the evaluation and management code, not on the procedure code. The reason is simple once you see it. The thing that is unusual here is the visit, not the procedure. The procedure was ordinary, so the modifier attaches to the part of the claim that needs explaining. Second modifier. Modifier 57 marks the evaluation and management visit at which the decision to perform major surgery was made, reported on the day of or the day before that surgery. Remember that 92-day window? Without this modifier, the visit that decided the surgery would fall inside the package and go unpaid. 57 is what pulls it back out. And this is why 57 is never used with minor procedures. A minor procedure's global period does not include the day before, so there is nothing to pull the visit out of. If the procedure is minor, your same-day modifier is 25. If it is major, it is 57. That is the whole distinction, and it is the most common mix-up on this topic. Third modifier. Modifier 24 is for an unrelated evaluation and management service provided by the same physician during someone else's postoperative period. Same surgeon, still inside the global window, but a completely different problem walked in the door. The word that matters in 24 is unrelated, and the exam is strict about it. It has to be genuinely unconnected to the surgery. Routine follow-up care is inside the package. Managing a complication of the surgery is inside the package. 24 is only for something that has nothing to do with why you operated. So here is the decision you actually run at exam speed. First ask, is this visit inside a postoperative period from an earlier procedure? If yes, and the reason is unrelated, that is 24. If no, ask, is this visit on the same day as a procedure? If yes, look at the procedure. Minor means 25. Major means 57. Let's run 3 real questions through it. First one. A physician removes a small skin lesion, a minor procedure with a 10-day global period, and at the same visit performs and documents a significant, separately identifiable evaluation of a new, unrelated complaint. Which modifier and on which code? The answer is modifier 25, appended to the evaluation and management code. Walk the options. Modifier 59 is wrong because 59 is for a distinct procedural service, and this is an evaluation and management service, not a procedure. Modifier 25 on the lesion removal code is wrong because the modifier belongs on the code that needs explaining, and that is the visit. Modifier 57 is wrong because the procedure here is minor, and 57 only applies to major surgery. Run the decision, not a postoperative period, same day as a procedure is minor, so 25. Second question. A surgeon evaluates a patient in the hospital and during that visit decides to perform a major surgical procedure, one with a 90-day global period, the following morning. Which modifier goes on the evaluation and management service? Modifier 57. 25 is wrong for the exact reason we just covered. The procedure is major, not minor. Modifier 32 means a mandated service, ordered by a third party, which is not what happened here. Modifier 24 is wrong because there is no earlier surgery in progress. This visit is before the operation, not after one. The day before a major surgery is inside that 92-day window, which is precisely why the visit needs 57 to be paid. Third question. 3 weeks after performing a knee replacement, a 90-day global period, the same surgeon sees that patient for an acute, unrelated sinus infection. Which modifier goes on the evaluation and management service? Modifier 24. Check the others carefully because this is where people lose the point. Modifier 58 is a staged or related procedure, and this is neither staged nor a procedure. Modifier 25 is same day as a procedure, and there is no procedure today. Modifier 79 is the tempting one because it also means unrelated during a postoperative period, but 79 applies to a procedure. This is an office visit. Unrelated evaluation and management is 24. Unrelated procedure is 79. Quick recap. 1 rule. A procedure's payment already includes the routine care around it for 0, 10, or 90 days. 25, same day as a minor procedure, and it goes on the evaluation and management code. 57, the visit that decided major surgery, day of or day before. 24, an unrelated visit inside someone else's postoperative period. And if it is a procedure rather than a visit, you are looking at 79, not 24. You can practice CPC questions free at .com/en/CPC. In English, Chinese, or Spanish with no sign-up.